Chapter 1, Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 1. Listen to dialogue number 1. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Hi, I was wondering if you could give me some advice. I was swimming in the ocean today, and when I got out, I noticed that I had all of these red bumps from my waist down.
Do they itch?
Yeah, I can't stop scratching them.
I can see from your scratch marks. You only went into the water up to your waist? Did you feel a sting?
Yeah, come to think of it, I did. That's why I left the water.
Well, it looks like you have a bumpy rash caused by a jellyfish sting.
A jellyfish sting? What should I do to get rid of this itch?
Are you allergic to any medications?
Not that I know of, but I don't think so.
I would recommend Benadryl tablets and hydrocortisone cream. You'll find them in aisle 5.
I have a hard time swallowing tablets and pills. Does Benadryl come in a liquid?
Sure, you can get it in a liquid form. Follow the directions for both Benadryl and the hydrocortisone cream. And if the itching and rash continues, call your doctor.
Thank you so much.
No problem. Glad to be of help.
Chapter 1, Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 2. Listen to dialogue number 2. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
I was wondering what I could do about the problem I'm having with my big right toe.
What seems to be the problem?
Here, I'll show you. I thought it was just oozy and blistery, but this morning when I got up and tried to put my foot in my shoe, it really hurt.
Is it sensitive to the touch?
Yeah, that's why I'm wearing open-toe sandals, so that the toe won't rub against anything. Even when I put a Band-Aid on it, it really hurts.
Have you been wearing tight shoes? When did you notice the watery blisters?
Well, actually, I ran a 10K race this past weekend, and it was raining, and my sneakers got wet. And that's when my toes started to hurt, and I saw the watery blisters.
Well, it looks like the wet sneakers and maybe not enough room at the tip of your sneakers caused the nail to get soft and the skin to get blisters. It looks like you have a fungal infection.
Fungus? Where would I get fungus?
Well, a fungal infection is caused by the moist environment created by your wet sneaker and socks rubbing against your toes. That's what has happened to your right toe.
What's going to happen to my toenail?
Well, it will most likely turn black from the dead nail and blood underneath it. Eventually, it will fall off, but in time, your toenail will grow back.
What should I put on it?
Do you have any allergies to certain medications?
Well, I'm allergic to sulfa and iodine.
Okay, don't put betadine on your toe, but if you go to aisle 3, you'll find Lamisil. This will help with the tenderness that you're feeling and will prevent the fungal infection from spreading. Follow the directions on the bottle.
How long will it take before my nail grows back?
It could take a while before your toenail will grow back, maybe a few months. If you continue to have problems, or it begins to ooze more blood, I suggest you make an appointment with a podiatrist, a foot doctor, or call your primary care doctor. Also, keep your toe dry and well ventilated until you feel comfortable enough to wear closed shoes.
Thank you so much. I'll be more careful next time I run another race.
Take care of your toes.
Chapter 1, Pharmacist-Patient Dialogues. Listening and comprehension exercises. Dialogue number 3. Listen to dialogue number 3. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple choice questions at the end of the dialogue.
Hello, can I help you?
I hope so. We're on vacation, so I can't make an appointment to see our pediatrician and was hoping you could help us. My daughter has been scratching her head a lot. I thought maybe she's scratching because of the sun.
Let me take a look at her hair and her scalp. Has she had head lice before?
No.
How old is your daughter?
She's 6.
It looks like she's got her first case of head lice.
She must have picked it up at day camp.
Maybe. It's not anything to be embarrassed about. I suggest you buy a metal louse comb and soak it in rubbing alcohol and run it through her hair to remove the wingless insects. They look like sesame seeds. I also recommend a medicated anti-lice treatment. Nix works well. You can find it in the shampoo aisle. It is also a good idea to wash her sheets, pillowcases, towels, and her clothes.
Is it hard to use?
No. First, wash her hair with shampoo. Rinse it and towel dry. Then rub the Nix cream into her hair. Make sure her scalp is fully covered with it, as well as behind the ears and behind her neck. Leave the Nix on for 10 minutes and then rinse. After that, use the louse comb to remove the lice.
How long will it be before the lice are gone?
If after a week she still has lice, repeat the process.
Is head lice contagious?
Yes, it is. So I recommend you and the rest of your family use Nix too. And wash your sheets, pillowcases, and clothes too.
Thank you so much.
Chapter 1. Post-Assessment. Dialogue number 1.
Hi. Can I speak with the pharmacist?
I am the pharmacist on duty today. What can I help you with?
When I woke up yesterday, I noticed that my arm was a reddish-brown color and was swollen. It is painful and itchy. It seems to be getting worse today. Is there a cream that I can buy that will reduce the swelling and relieve the itchiness?
Let's take a look at the arm. You're right. It is a brown color, and it is swollen. Let me ask you a couple of questions. Were you bitten by an insect, or did you hit your arm?
Not that I remember. But I was camping during the Labor Day weekend 2 days ago. Maybe I was bitten by an insect and did not notice it.
Okay, that seems possible, as I can see a possible bite mark. Has the swelling spread in the last 2 days?
Yes. At first, the brown color and swelling was only around my wrist. Today, it nearly reaches my elbow.
Have you noticed any pus?
Yes. As I was scratching my arm this morning, I noticed a small amount of clear fluid discharge.
Okay. It looks like you may have what is called impetigo, which is a mild skin condition that can be caused by an insect bite. I really think you should see a doctor today, since the infection in your arm is pretty big and spreading.
Really?
It looks like you're going to need a prescription for an antibiotic. But in the meantime, you may take Benadryl for the itching so you don't continue to scratch and spread the infection.
Benadryl? I've never taken Benadryl.
You need to be careful. Benadryl can make you drowsy, so don't drive or operate heavy machinery right after you take it. To relieve the pain, I recommend you take Tylenol or Motrin, unless you have any kidney or liver problems.
Actually, I take Tylenol a lot when I have a headache, and I don't have any kidney problems.
Good. You can find both Benadryl and Tylenol in aisle 4. And I know it's hard not to, but try not to scratch. The infection can spread and make things worse.
Thanks for all your help. I will call my doctor as soon as I get home. Thank you for your help.
Sure. Glad to be of help.
Chapter 1, Post-Assessment. Dialogue number 2.
Hi, can I speak with the pharmacist?
Hi, I am Mrs. Smith, the pharmacist on duty. What can I help you with today?
My feet are burning and itching, and the skin is peeling off. I'm starting to tear my hair out. How can I make the burning and itching stop?
Do you mind if I examine your feet?
Not at all.
Okay. You said that both feet are burning and itching?
Yes.
Okay. I'm going to remove your socks and shoes. Let's take a look at your feet.
Do I have athlete's foot?
Yes. The skin is scaly between your toes and on the soles of your feet. This scaliness, in combination with the burning and itching, is characteristic of a fungal infection called athlete's foot.
What should I do?
I recommend that you apply Lamisil cream twice a day to the affected area. You will use this cream for 2 weeks.
Can I stop using it if the burning sensation and itchiness go away?
It is important that you continue to use the cream for the entire 2 weeks, even if the burning and itching stops before then. If you don't use the cream for 2 weeks, the infection may return. Do you have any questions?
Do I need to do anything to my feet before I put the cream on?
You should wash and completely dry your feet, even between the toes, before applying the cream. In addition, you should change your socks daily and should consider wearing different shoes, as the fungus may possibly be living in your shoes if they are old or if they are constantly worn.
Where can I find the Lamisil?
Follow me. I'll show you where we keep it.
Chapter 1, Post-Assessment. Dialogue number 3.
Hi, are you the pharmacist?
Yes, I am. What can I help you with?
I feel a little embarrassed, but, well, I have a bad habit of biting my nails when I am nervous. I was biting my nails yesterday, and a very thin piece of my nail was ripped from the side of the nail. Today, the side of my index finger is red, swollen, and very painful. I was wondering what I should do for the finger.
I see. Have you noticed any pus or discharge from the nail?
Yes. There was yellow pus from the nail this morning when I pressed on the finger.
Well, it looks like you have an ingrown fingernail. There is a small infection in the finger, which is the reason for the redness, inflammation, pus, and pain. I recommend that you soak the finger twice a day in an Epsom salt soak. You can also apply peroxide to the finger. In addition, you should apply Neosporin to the finger during the day and cover it with a Band-Aid. You may take Motrin for the pain until the infection heals. The infection should be gone in several days. Do you have any questions?
Not at this time. Can you show me where the Epsom salts and the Neosporin are?
Sure. Follow me.
AVN Pharma Education.